This is DrAlvinCom, the business of wisdom where world leaders and thinkers do come to chat. Very fortunate to have the international best-selling author of Answers for the 4A Epidemic, Healing for Kids with Autism, ADHD, Asthma, and Allergies. I'd like for this extraordinary best-selling author to share your name. After you share your name, give me a brief synopsis of your expertise. Good morning.
Yes, I'm Dr. Joseph Cannizzaro. I'm a pediatrician in Central Florida for the past 30 years, and I practice holistic integrative pediatrics, which is based on functional medicine, which is systems medicine, functional biologic systems, and I practice in conjunction and collaboration with other healing modalities, practitioners of healing modalities, and like chiropractic and homeopathic and traditional Chinese medicine, and it's an integrative approach to care. It's a very preventive medicine, and I have my practice called the Pediatrician's Care Unit, and I've developed the Accordo Health Institute, which is the entity that I practice with these other healing practitioners, and we've got a very active practice. We have a nonprofit entity that we're going to be utilizing for clinical research grants in the future, and I became real interested in this epidemic and decided to write a book on it.
Is it truly an epidemic, or is it that we are recognizing and able to diagnose these situations earlier now?
That's a minor part of it, the diagnostic capability. As we've learned more and more about how functional systems work, we've been able to uncover the causality of the epidemic, which is in some ways complex, but it's pretty straightforward. There is a genetic predisposition with these children, but that's again a kind of a minor component. The environmental aspects of this is really where the causality lies. Environmental toxicity, which has developed exponentially, if you will. Environmental toxicity coupled with nutrient deficiency, and that's a horrible combination. The state of the nutritional status of children and beginning in utero. That coupled with another part of this toxic world, and that's the vaccination schedule. With too many given, too toxic, too young, that could have been done differently. But it has contributed to the toxic world that these children live in. And, of course, the children are the canaries in the mine. They're the most vulnerable, and they have a detoxification capability which is very, very limited. Energy is so much energy necessary for growth. There isn't much left for them to be able to detoxify, and therein lies the cause. And we're looking at 25 million children, and if we consider the other problems that children are having, behavioral problems, emotional problems, learning problems, the learning problems, the motor skill problems, the speech and language, and the sensory integration problems. It's 30 million children, and again, environmental toxicity is the culprit. So genetics does not cause epidemics. Again, there may be a genetic predisposition with these children, but the numbers are alarming, and what's even more ominous is that we're all exposed to this. And we're going to really, when we understand even more and more about how our immune system is reacting to this toxicity, it is beginning to explain a lot of disease entities that were shrouded in mystery up until now. And the good news is that all of these, at least most of these children, this is a reversible situation. It is not, as you might find in conventional medicine, a psychiatric incurable illness. It's anything but that. It's a metabolic problem, metabolic derangement that leads to problems in the central nervous system that you can recognize. It's a developmental disorder characterized by significant disabilities in social interaction, communication, and behavior. That's the kind of a brief definition of autism. It's a spectrum, and these children can have features of these various problems, and it's called individuality in an epidemic. And what I had decided to do in the book is not only to make people aware of this, to make all of us aware of this epidemic, but also to realize that we're all exposed to the causality, how we eat and how we live our lives, are major factors. And I wanted to reveal, and this is kind of unique, I think, in my book, that we need holistic integrative doctors to treat these children. And I've also added in the book features to help parents to learn more and more about it, and they've really come on board and are treating their autistic children and children with ADHD, which is really the same entity, just a different degree of severity. And parents have developed over the past 15 years the Defeat Autism Now society. It was put together by some pioneering physicians as well. And these parents are really in the trenches, and they're the major physicians. It's a physician-parent team that is very necessary to treat these children. Asthma and allergies make up the other two A's, and these are all all the same causality. When you have derangement of the immune system, that can lead to dysregulation, and all of these children have allergies, and of course, when it manifests in the lungs, we know it as asthma. I'm not an adult physician, but I would add a fifth A, and that's Alzheimer's. In this case, I believe it's just taken 5 or 6 decades for the same problems to appear in the manner of the effects of toxicity on the brain, and it's basically the same disorder. We could include it in the 4, and I make the point in the book of describing integrative medicine in detail and functional medicine. That's the roadmap that we use in order to integrate these various healing modalities, because the treatment for the disorder is food, is dietary changes, improving nutrition, supplements, and detoxification. And that's the healing. And and when it pertains to all of us, when I'm treating a child that's in the spectrum, and I make recommendations after laboratory studies, etc., the treatment is beneficial for the whole family in improving their diet and their nutritional status, and bringing the appropriate supplements on board based on, again, in-depth functional laboratory studies, and then get into detoxification. And detoxification can be done, is accomplished in many ways, and we go into detail to treat really the whole family this way. So it's really an awareness, to bring an awareness to folks that we're all involved with this, and And we can defeat it, but certainly we need to clean up the planet and reduce toxicity, get into and replace chemical agriculture with organic farming, and this can be done. And I note this in the book, and improve our nutritional status from good organic agriculture, natural farming, and then we'll be able to bring an end to something that is burgeoning right now, because these issues are not being approached. In medical education, I make some mention there. The a lot of emphasis needs to be put on teaching nutritional science. Nutritional science is really the core here, and it kind of forms a core with all these other sciences that form the basis of the other healing modalities that come into play to treat these children and adults.
Well, good doctor, we appreciate you sharing this powerful information. Tell me how to get a copy of the book. Let me know about any website, Facebook, etc., to be a part of your world.
The final comment really is if we institute these changes and learn. In the book, I've also mentioned the development of what's called a patient core, where as far as integrative medicine is concerned, for patients to point out, because it's very difficult to find integrative physicians. That's the major form of education here in the States, and just kind of make a list of patients, the doctor that they go to, and maybe approach the physician as the patient core and suggest some of the programs that are available to augment their practice of medicine by getting into some of the conferences and courses that are available to teach functional medicine and let these physicians really get into more preventive medicine and natural healing.
Well, thank you so very much, Dr. Joseph. This will be featured at DrAlvinCom, the business of wisdom where world leaders and thinkers do come to chat. Also, your book is available on Charisma website, and you continue to have a remarkable, amazing day, Dr. Joseph, okay?